Hello everyone, welcome to Dental Mate. Today in this video, we'll be discussing about tooth shedding. Let's get started. So what is shedding? It is a physiological process by which the deciduous tooth are removed to allow the succedaneous permanent teeth to take the functional position in the oral cavity. Now, why is it necessary? What is the significance of shedding? So shedding the deciduous tooth is necessary as the teeth do not grow after they are formed, and therefore they need to be replaced by a more number of larger teeth so that they can resist the masticatory forces and look aesthetically pleasing in the large jaw of the adults. Now, what is the mechanism of shedding? During shedding, there occurs resorption of roots of the teeth and destruction of the supporting periodontal ligament. The factors which are important are, first of all, the important factor for the process or mechanism of shedding is the pressure from the erupting permanent successor. See, this is an example in which we have shown the deciduous tooth, that is the deciduous molar, and the erupting permanent successor, which would be 3-5 for the deciduous molar, which is 7-5. This pressure, see, this erupting permanent molar, it applies a pressure to the root of the deciduous teeth, okay, in this region. Because of this pressure, what happens is there is differentiation of the odontoclasts. Now these odontoclasts, they resorb the dental hard tissue and thus the root is resorbed and the tooth is shed off. Okay. Now, in cases of congenitally missing permanent successors, we have seen that it is generally found that the deciduous tooth is retained for a longer period of time, thus supporting the role of pressure from the succedaneous teeth in exfoliation. Second factor is the force of mastication. Let us consider the adjacent tooth, which would be 7-4. So as the individual grows, the forces of mastication increases and it becomes greater than what the deciduous PDL can tolerate. Because of which what happens is there is trauma to the periodontal ligament followed by destruction, initiating the reabsorption and ultimately shedding of the tooth. So there is destruction of the PDL because of increased masticatory forces. This leads to the trauma of the period leads to its destruction, leading to the destruction and resorption of the root and ultimately shedding of the tooth. Although the deciduous teeth is retained for some times when the permanent successor is congenitally absent, but it ultimately exfoliates. Why? It is because of the increased force of mastication. So these are the two factors which together decide the rate and the pattern of resorption. Now, next, if we talk about the histology of shedding. So, shedding, there occurs two phenomena. First, there is destruction of the supporting PDL, and second, there is resorption of the dental hard tissue. Now, this resorption of dental hard tissue is by the help of odontoclasts. So what are these odontoclasts? These are the highly specialized cells which are responsible for the resorption of dental hard tissues such as cementum, dentine and enamel. They are originated by the circulating monocytes which are capable of giving rise to all the different type of tissue macrophages. Okay. Now these are large and multinucleated. So circulating monocytes give rise to odontoclasts. These are the odontoclasts which are large and multinucleated giant cells. They are located in the irregular base of the surface of resorbing dental hard tissue. So these are the irregular base. Now this is a resorbing dental hard tissue. These are the irregular base of this. So the odontoclasts are located here, and they may also be found in the pulp. So these odontoclasts, they have a ruffled border. Okay, this is seen in the electron microscopic view that these odontoclasts, they have a ruffled border adjacent to the resorbing hard tissue. Now this is the resorbing hard tissue. Here they'll be showing a ruffled border. And so what are these ruffled borders? These are the cell membrane foldings which like invaginate. Okay, cell membranes get invaginated to fix into these ruffled borders and to lay out certain enzymes to carry out the process of resorption. So therefore these ruffled borders are seen. Now in the depth of these invaginations, what are seen are the mineral crystallites. Okay, certain invaginations which are seen, in सारे invaginations के बीच में mineral crystallites are found. Large number of mitochondria and vacuoles are seen in the ruffled border cytoplasm. Along with that, they also have an increased level of acid phosphatase. So what is the resorption mechanism that they carry forward? There is a two-step mechanism. In the initial stage, first of all, what happens is, see, this is the matrix which contains the crystallites and this is the dentine which contains the crystallites and the matrix. So in the initial stage, what happens is, first of all, the crystallites are removed. After that, the organic matrix is exposed. And in the second step, the organic matrix is removed by extracellular dissolution into small molecules. There occurs phagocytosis of these organic molecules by odontoclastic vacuoles, which are rich in acid phosphatases. So they break down the ingested material, and along with that, there occurs abrupt perial ligament destruction without the accumulation of inflammatory cells. That is, there is apoptotic cell death in the periodontium. Next, if we talk about the pattern of resorption and the pattern of shedding. So the developmental position and the physiological movement of the successors are very important factors in determining the pattern of resorption and shedding. First of all, if we talk about the pattern of resorption. So the developmental position of the permanent incisors would determine the pattern of resorption for the deciduous incisors. So how do the permanent incisors erupt? They erupt lingual to the deciduous incisors. And after that, they occupy an apical position. So for the deciduous anteriors, the first sign of resorption is on the lingual aspect, followed by the sign of resorption on the apical region. Next, if we talk about the deciduous, the developmental position of the premolars. Okay, we must remember here one thing, that we must recollect one thing, that the permanent molars, they do not have any predecessors, right? Because the primary molars, unki jagah pe there comes the premolars, and the permanent molars, they are newly formed by the distal extension of the tooth bud of the dental lamina or the developing tooth bud of the premolars. So there are no predecessors for the permanent molars. Now if we continue talking about the developmental position of the premolars, then these are first located between the roots of the deciduous molars. Later they also occupy an apical position. Okay, now if we talk about the shedding patterns. So for the deciduous molars, first the resorption is seen in the inner aspect of the deciduous molar tooth, and then it slowly resorbs the root from the apex, and it continues till the root is completely resorbed and exfoliated. Okay. We must always remember that the root resorption process, it is not continuous. It has different periods of rest and repair. So the exfoliation of tooth would occur if the resorption predominates the repair mechanism. But there could be an option if the repair predominates the resorption, then there could be retention of the deciduous tooth. Now if we talk about the pattern of shedding, So the shedding mechanism, it is also symmetrical in the right and the left side. The mandibular teeth exfoliate before their compensate like जो complementary counterparts होते हैं in the maxillary arch. The maxillary and the mandibular deciduous second molars exfoliate simultaneously. Okay. Along with that, the girls exfoliate teeth earlier than the boys, and it is most observable in mandibular canine. The sequence of shedding is, first there is in the mandible there is anterior to posterior, and in the maxillary also it is anterior to posterior, but the deciduous molars shed before the canine. Next, if we talk about the clinical considerations. So if there is an over retained deciduous tooth, so see, when do we call a tooth as over retained deciduous? When the tooth is in the oral cavity for a longer period of time than the normal exfoliation period. Only after the normal exfoliation period of the tooth has been surpassed, only after that we can call the tooth as over retained tooth. So what could be the causes of the over retained tooth? First, there could be congenital absence of the permanent successor. So if there is no successor, there won't be any pressure exerted on the root of the primary tooth. There won't be any differentiation of odontoclast, and there won't be any shedding off. But we must also remember the second mechanism, which is what? The increase in the masticatory forces. So the increase in the masticatory forces might cause the deciduous tooth to shed off even when the successors are absent. This would need more amount of time, right? Okay, now there could be another reason that the successors fail to erupt. So there could be some breach in the mechanism of the root formation or the eruption of the successor tooth, because of which the deciduous tooth also, the resorption of the deciduous tooth root did not take place, and thus the tooth has been over retained. Along with that, there could be an ankylosed deciduous tooth also present. That is, ankylosed means it is fused to the bone. There could be an ectopic eruption of the successor. By ectopic eruption, we mean that the successor tooth, either it has erupted lingual to or in a labial position to the deciduous tooth. Along with that, sometimes what can happen is the remnants of the roots of the deciduous tooth could be seen. So this is commonly seen in the maxillary premolar region. Okay, the roots of the deciduous molars. What is the reason for that? Because the roots of the deciduous molars, they are very flared, okay, excessively divergent, and the distance between the roots of deciduous molar is more as compared to the diameter of the developing permanent tooth. So a portion of the deciduous tooth might escape resorption. Third point to consider for shedding is so what happens to these remnants? See, sometimes what happens is the unresorbed pieces, they may get resorbed or replaced by the bone, and if these remnants, they are closer to the surface, they extrude to the mucosa and they ultimately exfoliate. Third point to consider is submerged tooth. Okay, this tooth remains below the level of the normal occlusal plane. And what are the causes? If the tooth is ankylosed, okay, that is fused to the alveolar bone. What could be the causes of ankylosis? See, there could be a trauma or damage to the perial ligament. There is imbalance between the repair and the resorption process. Now, because of this submerged tooth, what could happen is it is unable to undergo the normal physiologic tooth movement. So there is no compensation for the increase in the bone height, right? The physiologic tooth movement, why is the physiologic tooth movement present or it occurs? This is because as the growth take place, as the jaws, like that is the maxilla and the mandible grow, there is an increase in the alveolar bone height. Okay, so there is no compensatory mechanism for this bone height, increase in the bone height if the tooth is ankylosed. And when the adjacent teeth continue to erupt, the ankylosed teeth, they remain submerged below the occlusion plane level. Okay, and the deciduous ankylosed tooth, they could, if a deciduous tooth is ankylosed, it prevents the further eruption of the successor. So a submerged tooth must be taken care of and extracted with with a radiographic confirmation of the presence of the successor tooth. So if the successor is present, then the submerged deciduous tooth needs to be extracted. This is it about the shedding of the tooth. Thanks for watching. Do not forget to like, share and subscribe to my channel. Do hit the bell icon. Also, mention in the comment section below if this video has helped you in any ways. Stay tuned, keep watching. Thank you.